All right, if you're a PMHNP student, you know exactly what I'm talking about. There's this one huge question that probably keeps you up at night, right? You're scrolling through forums, you're hitting up your classmates, you're watching video after video, all trying to crack the code which one is supposedly easier. And honestly, it's a massive source of stress.
But what if I told you that whole debate, all that anxiety, is because you're asking the completely wrong question?
The smartest strategy isn't choosing one, it's taking both. Yeah, you heard me right. Both. Instead of choosing or, the most powerful strategic move you can make for your career in 2026 is to prepare for and take both exams. Okay, let's dive into this.
So here's what we're going to cover in this explainer. We'll start with why or is the wrong question. Look at the exams as two halves of one whole, and we're definitely going to bust that myth about which one is harder. Then we'll talk about creating the ultimate safety net, how to study smarter, and finally, the huge career advantage this gives you.
Okay, so let's start with the big problem. Almost every student thinks you have to choose one path. It's ANCC or AANP. And that little word, or, creates so much fear, right? Like, what if you pick the wrong one, and it messes up your chances and throws your whole career off track?
But here's the thing most programs don't really explain. The exams are not enemies. They're not competing against each other. It's way better to think of them as two complementary assessments, two sides of the same coin. They're actually testing the same profession just from different angles.
So let's break that down. To really see why this strategy is so powerful, you've got to understand how they're actually different in their structure.
Okay, this is such a great way to look at it. The ANCC is really the why exam. It's testing you on the bigger picture stuff, nursing theory, your professional role, research, ethics, all that good stuff. But then you have the AANP, and that's the what exam. It's all about the nitty-gritty of clinical practice. Can you diagnose? Do you know your pharmacology? Can you make a solid treatment plan?
And here's where it all clicks. When you prepare for both, you're not just cramming facts to pass a single test. You're forced to actually master the entire field. You have to connect the why with the what, and that's when true understanding happens.
Which, of course, brings us to the million-dollar question, the one that fills every study group and online forum.
So what's the verdict? Is there one exam that's definitively the harder of the two?
The honest answer? Neither. They're just hard in completely different ways. It's kind of like asking if it's harder to run a marathon or lift a super heavy weight. They're just different kinds of hard.
So look at it this way. The ANCC challenges your conceptual thinking. Can you handle those abstract, theoretical questions? The ANP is all about your clinical reasoning. How quick are you on your feet with diagnosis and meds? So if you're someone who loves theory, the ANP might feel tougher. If you're all about the clinical side, the ANCC might trip you up. See what I mean? By studying for both, you're basically covering all your bases. All right, let's get into something super important that people don't talk about enough when it comes to board exams: risk. Think about the typical path. You study for months, you pour everything into this one single exam. The pressure is absolutely insane. And if you fail, man, it's brutal. You've got to pay again, you have to wait for weeks, and the worst part is rebuilding your confidence from scratch. It's a high-stakes gamble.
But when you're prepared for both, you've just built yourself the ultimate safety net. If one exam day is just off, for whatever reason, it's not the end of the world. You have another shot ready to go. You're not putting all your eggs in one basket, and that alone just crushes the anxiety, which, ironically, usually means you perform better anyway.
Now, I know what you're probably thinking. This sounds great, but isn't that just double the work? Well, here's the hidden advantage, the part that makes this strategy so smart.
There is a massive content overlap. I mean, look at this list. Diagnoses, psychopharm, therapy, assessment. This is the core of psychiatric nursing, and it's on both exams. You're not studying two different subjects. You're just getting a 360-degree view of one. And that's why it's about studying smarter, not just harder. It forces you to move beyond memorizing little facts for one specific test. You have to actually understand the material on a deeper level to build real clinical judgment. And guess what? That's what these exams are really trying to measure anyway.
But it's not just about passing the boards. This is about your career. Let's talk about the unfair advantage this gives you on the job market.
Here's a dose of reality. Employers sometimes have a preference. Big federal systems like the VA often lean towards the ANCC. Certain private hospital systems might favor the AANP. If you have both, you don't have to worry about it. You are a yes for any system. It gives you maximum flexibility and opens up every single door.
And just think about the statement that makes. When a future employer sees you're dual certified, it says you didn't just pass a test. It says you went the extra mile to master your entire discipline. That puts your resume at the top of the pile, period.
So it's time to change the question. Stop asking, which one should I take, and start asking, how can I master both? It's a total mindset shift from one of fear to one of strategy.
So, I'll leave you with this thought. Are you going to pick one path and just hope for the best? Or are you going to make a strategic move to master the whole profession, reduce your anxiety, and become a more competitive clinician from day one? The choice is yours.